Knock, knock. Hi guys. I'm board certified dermatologist, Dr. Abby Waldman. After making this video on home microneedling, I got lots of questions about best practice. So today I'm going to answer all of your questions. So let's get to it. So how do you avoid hyperpigmentation with microneedling? I know some people with darker skin can experience that. It is true that if you have darker skin, you need to tread more cautiously with many cosmetic procedures. All in all though, based on systematic review, they have shown that microneedling is the safest procedure for those with darker skin compared to, say, laser, chemical peels, or other procedures. So while the risk of hyperpigmentation is not zero, it is pretty low. Here are two things that you can do to reduce your risk of getting hyperpigmentation while using home microneedling. So the first is choosing short needles, less than 0.5 millimeters. It will say on the package how deep the needles go. Two, you want to avoid the sun like the plague for 2 weeks after your procedure. You can use a wide brimmed hat, sunscreen, sun avoidance, but this is by far the most important thing you can do after any procedure to avoid hyperpigmentation. Would you avoid the under eye if you have or are prone to milia there? The main concern would be of making the milia worse. So first, milia are teeny tiny little cysts in the skin that occur when you get irritation or occlusion of the skin. Paradoxically, microneedling can treat milia in the under eye by increasing skin turnover, but also they can cause irritation, so they do have the potential to causing milia in the under eye area if you are prone. Now, usually these are self-resolving after several days if they do occur, and if you decide to take the gamble in the under eye area, just make sure, again, needles are 0.5 millimeters or less, and you press really gently. Another question about location is lips. Can you do lips? Yes. The upper and lower cutaneous lip, very safe for microneedling. How about the actual vermilion lip? This here, I know it's popular to do it to make it kind of look like filler. You can also do it for hyperpigmentation. You just use caution. The skin is very thin on the vermilion lip, and you just may want to do a test area first. Never use needles that are deeper than 0.5 millimeters. And again, avoid the sun like the plague after. Use a gentle moisturizer to keep the skin moisturized. Which numbing cream can you use? So as long as the needles are less than 1 millimeter depth, numbing medicine is not usually needed for home microneedling. But if you do find you need some numbing medicines, such as areas that are very sensitive, like the upper lip, like we were just talking about, it is totally safe and fine to use an over-the-counter numbing medicine. Generally, you're gonna look for one that has lidocaine 4%. You put it on an hour before the procedure, and you put a piece of saran wrap over to keep it in place and make the numbing medicine work better, and then rub it off. You don't want to apply it to too large of an area, but it's totally safe in a small area. Make sure to take it off before you actually do your procedure. Can you explain what to do days before and after doing this at home as far as using actives? Thanks so much. So days before you do home microneedling, you really want to avoid sun exposure. That's the case for any sort of laser or procedure, and that is because you don't want to damage your skin and make it go in skin repair mode. You want it to be really well rested before you do this. You can do your normal skincare routine the night before. Some people want to stop their routine, stop doing tretinoin and things like that. You don't have to. Immediately after or later that day, you are fine pretty much using most serums. Let's see what I have here. That's a vitamin C serum. That's a peptide serum. You can use a hyaluronic acid serum. Most serums are gonna be fine. You can even put it on before you do the procedure too, if you find that it feels better on your skin. That's safe. I usually put it on after, but either one is fine. Also, safe ingredients to apply after are a gentle moisturizer. Coconut oil is fine. That's a question I got too. Microneedling is safe to do day or night, but if it is in the daytime and you're headed outside, you need to wear a wide brimmed hat. Avoid the sun if you can, and if not, apply a mineral-based sunscreen for any exposed skin. I have really sensitive skin. Is it okay to do it? So if you have very sensitive skin, it is okay to do home microneedling, but after, you may just really want to stick to something simple like a barrier cream. You can use just everyday diaper cream. You can use Cicaplast, La Roche-Posay Cicaplast Balm. All of those with zinc, they really can soothe the skin after if you have very sensitive skin. So what do you want to avoid? Pretty much anything with AHA, BHA, like glycolic acid, salicylic acid, lactic acid. All of those are really gonna burn if you put them on within the first 12 hours after microneedling. Also, they can damage the skin barrier further, so you really want to avoid those products if you can. Certainly, it's okay to use them the following night. Really, just that first day you might want to avoid. Other ingredients to consider avoiding, including retinol, tretinoin, for the same reason that they can be irritating, they can damage the skin barrier. Now, that being said, if you have been using retinol for a very long time and you sort of know how your skin would react to a retinol or tretinoin, then it is fine to use it that night. Just know it may burn a little bit and you may really get a little bit of skin irritation. So kind of use with caution, use at your own discretion. Personally, I do use my retinoid the night of microneedling, but again, I've been doing it for a long time and kind of know how my skin's gonna react. If I do use a retinoid that night, I definitely put a barrier cream over to really protect my skin barrier. Do avoid makeup that day that you do the microneedling, but it's fine to do your makeup as normal the following day. On the Banish website, the 3.0 is featured, and I would like to know what is the difference in that and the 2.0 that you demo. Also, do you use the 3.0 the same way that you demoed the 2.0, not repeatedly stamping in an area, but just moving slightly next to it for the next stamp? Thank you. So I did that first video. The 3.0 was not out, but now I have it. So the biggest difference between the Banisher 3.0 compared to the 2.0 is that the 3.0 has disposable heads. So it comes just as the handle, and then you get two disposable heads that click on just like this and look exactly the same otherwise. And otherwise, the procedure is exactly the same. You're gonna slowly move over the skin with some overlap. It is also okay to do repeat coverage, meaning going in the same place, especially if you have a troublesome area and that you want more effect. Do know that you might have a little more irritation in that area. So the next question is, don't we have to clean the device after putting it into alcohol, or can we apply just after taking it out from the alcohol? Will it not affect the skin? So to prepare your microneedling device to do home microneedling, it's important to let it sit in isopropyl alcohol for at least 5 minutes, and then you take it out and you're gonna let it air dry. At that point, you are ready to go. You don't need to wash it or do anything. It's washed, it's sterile. You need to clean your skin with a gentle cleanser. You can prep with alcohol, although I do find that's a little bit irritating. Now, after finishing up and using it, you may notice some debris on the stamping device. In that case, you can rinse it with water in the sink to get some of that debris, but then you do wanna re-sterilize it in the isopropyl alcohol. That's the last step before you put it away in the box to be able to use for the next time. Is there a stamp that you recommend for the thighs? I lost weight and have loose skin on my upper inner thighs that I would like to try microneedling on. Well, first off, congratulations on the weight loss. That's incredible. So microneedling is safe on the body. It is effective on the body to a certain extent, and certainly on the inner thighs, that should be fine. Depending on the laxity of the skin though, it just may not be enough. It might not provide all the tightening that you're looking for, and you may need to consider a more invasive procedure to tighten the skin, thermage, therapy, different sorts of procedures that really tighten the skin, or if it's a significant amount of skin, you could even consider surgery. Now, if the laxity is pretty mild or moderate, then you may see some benefits from doing home microneedling. And in this case, you are gonna look for longer needles so that they can penetrate into the dermis of the thicker body and leg skin. You're gonna look for at least 1.5 millimeters. The Skin Medics is an example of a stamping tool that comes in a 1.5 millimeters. I haven't used it personally. Derma Roller, honestly, in this case might be faster because you can cover a larger area, you can get through tougher skin. The downside of a Derma Roller is it can tear the skin a little bit. Usually less of a risk on the body and trunk skin than when compared to the face. And there are several different Derma Rollers that are available in a 1.5 millimeter needle length that you can just find on Amazon. So please subscribe if you found that useful. Really, my goal is to bring dermatology to you. I really think that everyone should have access to all the information that your dermatologist has so that you're empowered to take care of your skin. Please like this video, comment, and I'll see you in the next video.